Morning, Clooney. My name is Sven and I will be your physician assistant today. What brings you in to see me?
Well, I have had this rash and crazy blisters for the last 3 days and I can barely sleep.
Let's have a look. Can you tell me any more about the rash? Does it itch or burn?
Yeah, it feels like my arm and hand are on fire.
Have you taken any medicine to help alleviate the burning and itching?
I tried some aloe vera gel thinking it would soothe the burn, but it really didn't do anything at all.
Have you noticed any of these same symptoms anywhere else on your body?
Yeah, my left arm has been starting to itch pretty bad too.
Okay. Has anyone around you, family, friends, co-workers had any of these same type of symptoms?
No, not anyone that I have been around recently.
Are you aware of any allergies that you may have?
I know that I'm allergic to cats, but I do not think I am allergic to anything else.
Have you ever been tested in a clinical setting for allergies?
No, I just know I'm allergic to cats because I start to sneeze and my eyes get really watery.
Have you been outdoors lately or in any sort of environment that is not part of your normal routine?
Actually, last weekend I went camping with some friends. A bunch of them decided to go swimming and I decided to go for a hike in the woods looking for some of those mythical four-leaf clovers. I really didn't stay on the trail and was venturing off into the woods and digging around with my hands. Is that what you think it is, Doc? Something in the woods?
Perhaps. I would also like to remind you that I am a physician assistant and not a doctor.
No problem.
Okay, so it is highly likely that you did come across either some poison oak, poison ivy, or poison sumac while you were looking for your four-leaf clovers. Urushiol is an allergen contained within the sap material of leaves, stems, seeds and flowers that causes an outbreak on the skin just like the one you have. This is called dermatitis, which is a special form of allergic contact. Dermatitis. Most likely you came into contact with a leaf that contains the urushiol allergen.
So what do I do? Will I have to live with this for the rest of my life? I'm never going to get a date.
We are going to take care of this, Clooney. When you get home, I would like you to wash all of your clothes, shoes, and any other items that may have come into contact with the urushiol allergen. I'm going to give you an option. Would you prefer an injection or an oral medication?
Let's just do an injection and get it over with.
All right. I am going to give you an injection of 40 milligrams of triamcinolone. If you would have preferred the oral medication, I would have prescribed prednisone. If it would have been a mild to moderate reaction, we would have just stuck to some topical steroids.
Are there any side effects to the injection?
If you experience any nosebleeds, sore throats, increased coughing, runny nose or headache, you need to contact me. If you notice any white patches in your throat or nose, you need to contact me immediately or go to the emergency department because this indicates a serious side effect.
What about sleeping at night? Will I finally be able to get a full night of sleep? The sleep deprivation is killing me at work.
Yes, of course. You can actually take an over-the-counter antihistamine such as Benadryl to help you sleep through the night. That will also help control the itching while the rash resolves over the next few days.
What if it doesn't go away?
Not to worry, it will go away. I would also like to perform a patch test on you in order to test for any other allergies that you may have.
Is it going to hurt?
No, you will actually wear a patch on your back with different allergens. You will not be able to shower with the patch on. I would like you to follow up with me in 2 days and then we can go over the results of the test.
Is this rash going to scar?
You need to make sure that you don't scratch yourself, otherwise it may become irritated and lead to some scarring.
Can you write me a doctor's note for work?
Of course, I'll have my medical assistant do that on your way out. Also, make sure you set up an appointment with her for your follow-up.
Okay, thank you, Mr. Sven. I'll see you in a couple of days.
You're welcome. My assistant will be right in to set you up with a patch testing and go over any questions that you may have. Make sure you wear protective gear next time you are out hunting for those four-leaf clovers.